Coming to puberty in male versus female, puberty is developed into secondary sexual characters. In female, it is around 10.5 years, and in male is 11.5 years. The sign is growth spurt. Here is testicular enlargement and pubarchy, pubic hair, axillary hair, and peak height velocity. And there is menarche, onset of menstruation at 12.5 years, present on chromosome 6 and 9. And here penile enlargement, pubarchy, and peak height velocity. Coming to precocious puberty and delayed puberty. Precocious puberty is where the females and males develop or start developing secondary sexual characters in earlier age itself. In females, it is around 8 years, less than 8 years of age, breast budding appears. In males, less than 9 years. Most common cause is idiopathic. It is most common in girls, and it is due to excessive estrogen. And drug of choice is GnRH, continuous GnRH. And delayed puberty is where in female secondary sexual characters have not appeared by 13 years. In male, testicular enlargement has not even occurred by 14 years. Most common cause is constitutional delay. It is more common in boys. And in females, delayed puberty is generally pathological. Drug of choice is GnRH pulsatile. We can remember this by a mnemonic: precocious and delayed, as girls are always come beforehand to any meeting, and delayed and boys always come late to a meeting, more common in boys and more common in females. And precocious menstruation is when menarche occurs at 8 years of age anamata. Precocious puberty, there are mainly true precocious and peripheral. True is mainly due to central. It is due to premature activation of HPO axis, that is hypothalamo pituitary ovarian axis. There is increased LH, FSH and estrogen. It is due to increase in estrogen. Puberty is always isosexual. Isosexual is development of the female characters in females and male characters in male. The causes are 90% idiopathic and 10% is to brain tumor, that is hamartoma of tuber cinereum. Always do MRI of brain. And then peripheral is due to exogenous production of estrogen. There is isolated increase in estrogen and androgen. There is negative feedback on LH and FSH, and there is decreased LH and FSH. It can be due to higher estrogen and higher androgen. Estrogen causes isosexual, and this leads to heterosexual. Causes: increased estrogen is due to granulosa cell tumor or hypothyroidism and McCune-Albright syndrome. And coming to McCune-Albright syndrome, it is a triad of cafe-au-lait spots and polyostotic fibrous dysplasia in precocious puberty. We can remember it by a mnemonic CPR. C means cafe-au-lait spots, and P is for polyostotic fibrous dysplasia, and PR again for precocious puberty, PR. And also the peripheral precocious puberty is also due to increased androgen, which is due to Sertoli Leydig cell tumor, which is an androgen secreting tumor of ovary, and CAH, congenital adrenal hyperplasia.